Thank you, Mr. Chairman. This hearing means a lot to me. As a provider myself, many of the issues on today's agenda are priorities of mine. Ensuring patients have access to quality providers is the most fundamental reason why I came to Congress in the first place. I want to talk for a moment about why this hearing is so important. Providers choose to work in healthcare because they care about people. They invest years, often decades of their lives to training, and then they work grueling hours, many of them. They sacrifice time for themselves and time for their families to take care of patients. And while they're working, they have the lives of others in their hands, which can be incredibly stressful. We owe it to these providers and their patients to allow them to focus on patient care, not worry about the massive amounts of paperwork waiting for them at the end of the day, or about the long-term ability to operate their practice. We know Medicare is the single largest payer for healthcare services in this country and often shapes how private plans approach coverage. It is critical that we ensure Medicare operates in a way that supports providers, thereby ensuring that the millions of seniors who rely on Medicare continue to have access to their doctors. My passion for this issue is why I've worked for many years to get the Improving Seniors Timely Access to Care bill across the finish line to remove certain prior authorization restrictions from Medicare Advantage. It's why for years I've led the charge in bipartisan efforts to ensure that physicians are reimbursed appropriately, including H.R. 2474, to provide them with inflationary updates to reimbursement levels. And it's why I believe strongly that we must pass legislation to promote value-based care, as was intended when Congress passed MACRA, the Medicare and CHIP Reauthorization Act, in 2015. I hope my colleagues will join me today in recognizing the importance of these issues and commit to working with me and others on this committee to ensure provider access for Medicare patients. Mr. Chairman, I yield back.